Hello friends, welcome to my channel. I'm Dr. Himanshu Gupta and in this video we are going to discuss bone tumors. So do like the video and subscribe my channel to stay updated about the new videos that I'm going to post. So first I will be discussing with you the questions of the various tumors and in the end we will discuss the answers. So the most common bone tumor in the first decade is most common bone tumor in the first decade is most common bone tumor in second decade is most common bone tumor after skeletal maturity is tumors of the epiphyseal region are tumors of the diaphyseal region are most common primary formats to bone is most common primary formats to bone is most common true benign lesion most common true benign lesion most common true benign tumor is Codman's tumor is another name for malignant cells in GCT are giant cells or mononuclear cells. You have to choose between two. Physalliferous cells are seen in Physalliferous cells are seen in fallen leaf fragment or trapdoor sign is seen in ameloblastoma. Most common site is ameloblastoma. Most common site is adamantinoma. Most common site is purely osteoblastic secondaries are seen in what is diaphyseal ecclesia? Ollier syndrome is Maffucci syndrome is what is the origin of Ewing sarcoma? It is most common in which age group? Genetic defects is translocation between 1122, 2122, 722, which is a specific marker for Ewing sarcoma. So now we will discuss the answers. Now we will discuss the answers. The most common bone tumor in first decade is Ewing sarcoma. Ewing sarcoma. Most common tumor in second decade is osteosarcoma. Osteosarcoma. Most common tumor after skeletal maturity is giant cell tumor. Giant cell tumor. And most common tumor after 40 years is METs more than multiple myeloma. Tumors of the epiphyseal region are, you can remember it with the mnemonic ECG, where E stands for epiphyseal region, C for chondroblastoma, and G for giant cell tumor. Giant cell tumor. Tumors of the epiphyseal region are osteoid, osteoma, Ewing sarcoma, adamantinoma. Most common primary formats to bone is breast cancer, followed by prostate cancer, followed by lung cancer. Most common true benign lesion is non-ossifying fibromas. Non-ossifying fibromas. Most common true benign tumor is osteoid osteoma. Osteoid osteoma. Remember that in osteoid osteoma, you will see a lytic lesion in the bone which is surrounded by a focus of sclerosis. Lytic lesion in the bone which is surrounded by a focus of sclerosis, and its pain is relieved by taking salicylates. Salicylates. Pain is relieved by taking salicylates. Here also you see a lytic lesion. Codman's tumor is chondroblastoma. Chondroblastoma. Most radiosensitive bone tumor is radiosensitive bone tumor is Ewing sarcoma. But still the treatment of choice is not radiotherapy. It is neoadjuvant chemotherapy. Malignant cells in giant cell tumor are of mononuclear variant. Ficelliferous cells are seen in chordoma. Chordoma. It is a tumor of which origin? Notochord remnant. Notochord remnant. Most common location of chordoma is sacrum. Sacrum. Followed by clivus. Clivus. Fallen leaf fragment or trapdoor sign is seen in unicameral bone cyst. Unicameral bone cyst. It is common in first decade of life. First decade of life. This is how unicameral bone cyst looks like. Trapdoor or fallen leaf sign. Trapdoor or fallen leaf sign. Mieloblastoma, most common site is mandible. Mandible. Adamantinoma, most common site is tibia. Purely osteoblastic secondaries are prostate, then carcinoid, prostate, carcinoid, and medulloblastoma. Medulloblastoma. You can remember it with the mnemonic PCM. Diaphyseal achalasia is osteochondroma. Osteochondroma. It is a developmental defect in which you will see a bony outgrowth from the diaphysis of the foramen. What is the name for multiple hereditary multiple osteochondromas? It is Masada syndrome. Masada syndrome. Ollier syndrome is enchondromas. These are most common tumors of the hands and feet. What is Maffucci syndrome? You can remember it with Polyers means only enchondromas, only enchondromas. Mafuchi is enchondromas plus hemangiomas. Having sarcoma origin is bone marrow. Age group is, it is most common in second decade of life. Friends, there are two questions, you don't have to get confused. Most common bone tumor in first decade of life is Ewing sarcoma. But if they ask Ewing sarcoma is common in which age group, it is second decade. So which is a specific marker for Ewing sarcoma? It is MIC22. Poor prognostic factors in Ewing sarcoma is fever, increased TLC, increased ESR, METs, chemo-resistant and relapse. So this is the picture of, what is this, friends? What do you see? These are the tumors of the hand. These are enchondromas. What do you see, friends, here in this picture? You see periosteal reaction. It is seen in Ewing sarcoma. Where do you get sunray appearance? Sunray appearance is seen in osteosarcoma. What do you see, friends, in this picture? What is this? Identify. It is fibrous cortical defect. And it is associated with which syndrome? McCune-Albright syndrome. And what are the other features you see in McCune-Albright syndrome? Cafe ole spots. And precocious puberty. Hope you friends you like this video. Thank you for watching the video.